Hello, students. Well, we can see the light at the end of the tunnel now, and we're starting week 15. Yahoo! And so today we're going to be talking about chapter 30, and it involves treatment settings. And so the objective for this particular chapter is going to be to understand and identify the various outpatient, inpatient programs and the pros and cons of each type of setting. And we're going to define and identify the various types of aftercare programs. So the last time we talked about was intervention and how using that methodology or what ways you can get a person into treatment. So now that we're going into treatment, we have to decide what kind of treatment does this person require. And so we need to be familiar with the various treatment settings to be able to make the best informed decision, for everyone to be able to make the best informed decision as to what to achieve and how to achieve and where to go. So it is important to match the client's needs to a treatment setting. The goal is to place a client in the least restrictive environment that is still safe and effective, and for them to, in a long continuum of care, as they demonstrate the capacity and the motivation to cooperate with treatment, and they no longer need a more structured setting or types of services offered in the environment. Like example, do they need medical or nursing supervision, or do they still need room and board? So individuals who were involved in a treatment program or a 12-step program were more likely to be abstinent 16 years after they entered rehab. So that is a selling point for treatment. A detox program is not the same as a substance abuse program. So a detox program is going to be, short term, like a few days, to be able to put in a facility where they have medical observation and they have the necessary care to be able to go through a withdrawal in a safe environment. A detox is a form of treatment that involves the process of being withdrawn from drugs from his or her system. The decision to be made is, can it be done safely on an outpatient basis, or should it be carried out in a medical facility? So, excuse me. Treatment for a substance use disorder is delivered at various levels of care and many different settings, as we well know. So substance abuse treatment must continue for a sufficient length of time to treat the disease. So providing lower than the recommended level of care or using a shorter length of treatment than recommended will increase the risk of relapse and could cause the client to lose hope in the treatment process because they will see it as ineffective. So with that said, we're going to look at outpatient treatment. Outpatient programs utilize both individual and group therapy to help address the client's substance use disorder. Most outpatient programs follow a 12-step format, and clients are expected to attend regular self-help meetings on their own as part of the rehabilitation plan. So you may be in a program, but they're not going to be responsible for taking you to the meeting or helping you participate in the meeting. That is your responsibility because that's going to be a part of integral health that you need to incorporate as a strategy for success. So abstinence from alcohol and illicit drugs is not only effective, but a prerequisite for continued participation in an outpatient treatment program. And of course, this is spelled out to the client prior. And once they come drunk, inebriated, intoxicated, whatever high, whatever it is, then you will not be able to allow them to participate. And this has been them ahead of time. So there's different outpatient treatment formats. One of them, and it goes from, I guess, you know how we had said earlier that it's the least restrictive to the most restrictive. And then you may have to go gradually through them. Some people go all the way through these steps. Some only go one step. Some depends on a client's need, correct? So we start off with DWI school. And that usually is when you're got a ticket or where you had some infraction and they're recommending that. All right, so you go to that, learn classes, you get educated, and there you go. But then the next step is individual rehabilitation counseling. And this is a step further. In short-term outpatient program. And that may be where you go to groups, you may be going to see a therapist, you may be going for some drug treatment. And the next step would be intensive short-term outpatient program. That means you're probably going all day, every day, and you're going to meetings every day. It's much more intense, which means the situation is much more severe. And then you have severe long-term outpatient program, which here is for the person who's not experiencing success and needs care like that is much more intense to be followed up on. So the advantages of going to outpatient rehabilitation is one, that it's less expensive. It can cost anywhere from between $5,000 to $10,000 for 3 months because they're going to be charging you for the doc, the therapies, etc., etc. But it's going to be on an outpatient basis. So it minimizes the removal time from his or her daily environment. That means you can still, be at home. You can still go to your school. You can still do some of the things that you were doing to try to have some sense of normalcy. And there is some degree of flexibility allowing for alterations to work and family obligations. So an outpatient rehab program could allow you to continue to live at home, be working with your family, stay at your job, stay at school, meet the different obligations that you're having to address during the time that you're going to treatment. And the next thing would be, if that was the advantages, are there any disadvantages? Well, some insurance programs do not cover outpatient treatment. They only cover inpatient. And so you would have to bear the cost there or work with them on a scholarship basis or whatever it is. Outpatient does not offer the same degree of structure and support as a residential treatment. So you may be working on outpatient, but you need more because you're not really following the rules because there isn't that enforcement that you need. You haven't developed the internal controls and still need the external controls. So exposure to drug use cues in the current environment, along with the struggle with strong cravings, can be challenging as an outpatient client. So say, for instance, you're working your program really hard, but then you're still in the environment where people are smoking, where drinking, drugging. And so, you're looking at things, seeing things, smelling things. And so it could be harder for you to be in an outpatient program. So we're looking at residential treatments programs. And in the residential, the residential treatment programs provide a 24-hour treatment milieu with staff members on duty 24 hours a day. So here's where you have access to someone all day long, all the time. Residential treatment programs are effective in working with the resistant, suicidal, or homicidal clients, or clients unable to abstain in a less restrictive environment. These people need supervision, they need medical care, they need constant support. The decision for which program to use is based on assessed need for a significant level of care. Generally, a hospital, freestanding facility, or therapeutic community setting can be considered in this category. So, let me get my little forms here. Residential inpatient treatment is a resource-intensive, high level of care, generally for the client who has a severe level of addiction, whose mental health and medical needs and addictive behaviors require a 24-hour structured environment to make recovery possible. So the advantages of an inpatient treatment provides a more comprehensive level of care, as well as allows for intensive focus on the environmental issues. If everything around you, family, work, drugging, drinking, friends, are interfering with your recovery process, and here is where you're going to learn techniques to deal with those environmental issues. It can serve as a combination of detoxification and residential treatment programs. Some programs are not set up to have detox, and some are set up to do everything from be detox, inpatient, outpatient, partial care, aftercare, everything. It allows for the proper medical treatment of medical problems. And we know already that people who have substance use disorders, alcohol use disorders, have a lot of medical problems prior or as a result of the misuse. And the likelihood of completing a residential program is almost 3 times higher than completing an outpatient rehabilitation program. So let me say that again. The likelihood of completing a residential program is almost 3 times higher than completing a rehabilitation outpatient program. And that tells you that when you're on outpatient, you have so many more challenges that you have to experience and negotiate daily. Whereas when you're in a safe, secure place, you can focus on other issues instead of constantly having that on your mind. And so we're also talking about the disadvantages of inpatient treatment. And of course, the first thing we're going to look at is money. It is expensive, ranging from $6,000 at the low end to up to $60,000 for a 30-day program. And yes, treatment is very expensive, and insurances cover it or they don't cover it. And some places have scholarships, some places do not. And some people, like we said earlier, leave early or pick a program that's shorter, cheaper, but then it doesn't work, and then the client loses faith in the treatment process. So geographically, it means that if you're in some treatment program, it may isolate you and prevent you from contact between you and your family. So say, for instance, if you live in Texas and you're going to someplace in Florida, California, or wherever, and your family is not located close by and does not have the resources to visit you often, then it does hamper the component of family that is so necessary for people to be reintegrated into their family. And so inpatient care can be disruptive to the individual's established life routine. You can't go to your job, you can't go to your school, you can't see your family on a regular basis, you can't complete your obligations. Excuse me. And some programs are not stratified as to intensity client need. In other words, some programs are cupcake design rather than specialized need design. And we talked about that when we talked about special populations. So we look at one part, it's continuing participation in aftercare or self-help programs following treatment also appear to be one of those factors that are associated with success in treatment. So the proposed goal of aftercare program is to provide during clients' transition from intensive treatment to self-directed recovery. Client's referral is based on his or her needs. So in order for a client to make that transition, because we always talk about earlier the continuum of care, to the least restrictive to most restrictive, and then again to least restrictive. And the goal is for the client, to achieve self-directed recovery. That means they're in charge. Sometimes you need referrals to some programs, and you're going to make those referrals based on the client's needs. So a client can be referred to a partial hospitalization option. Partial hospitalization is for clients with more severe substance use disorders, but who can still be safely managed in their home living environment. And they may be referred to a higher level of care called partial hospitalization or day treatment. The client's opportunity to participate in treatment can be like 4 to 6 hours a day, at least 5 days a week, while they're still at home. And this option is also popular with adolescents because they can go to school during the day and still be in the program during the day. Clients can also be referred to a halfway house, or clients can be referred to a sober house. And that concludes this chapter 30, having to do with the various treatment programs. Thank you.